Hey everyone, and welcome to my YouTube channel. My name is Miss Phillips, and this is my first ever YouTube video. This is an educational channel, and the goal is to inform and educate families of students about the various aspects of special education. Please click like under this video and also subscribe to my YouTube channel. Today we will be looking at autism spectrum disorder. I will also touch on the definition, causes, risk factors, diagnosis, characteristics, and the effective educational program for students. I have also included in my presentation links to other websites which will offer additional information on autism spectrum disorder. What is autism spectrum disorder? Autism spectrum disorder is a developmental disability that can result in significant delays and developmental differences in a number of areas, including communication, social interaction, and behavior. What are some of the causes? Researchers are still investigating possible causes, but for today's purposes, I will be looking at genetics and environment. Genetics. Several types of genes seem to be involved in autism spectrum disorder. For some children, Rett syndrome or Fragile X syndrome are genetic disorders associated with autism spectrum syndrome. In other cases, genetic changes may increase the risk of autism spectrum disorder in some children. Environment. Research is being done to determine if factors such as viral infections, medications, or complications during pregnancy, or air pollutants play a role in causing autism spectrum disorder. Here are some possible risk factors: gender, family history, other disorders such as Fragile X syndrome, tuberous sclerosis, and Rett syndrome, extremely preterm babies, and older parents. Two ways in which a child can be diagnosed for autism spectrum disorder are medical diagnosis and educational determination. Medical diagnosis. In order to receive a medical diagnosis, a child must go through the process of screening and diagnostic evaluation. This is done by a licensed physician or psychologist, and it is usually based on the criteria listed in the Diagnostic and Statistical Manual of Mental Disorders. Educational determination. An educational determination is done by a multidisciplinary school team, and it is based on the rules governing individuals with disabilities Education Act of 2004. This is required to access the much-needed educational services. These are possible characteristics: social communication impairments, speech-language impairments, restricted repetitive and stereotype patterns of behavior, interests, and activities, executive function impairments, common learning characteristics, and additional considerations. Social communication impairments. Common social difficulties include: some may reject or ignore the social approaches of others, using and interpreting body language. For example, individuals with autism spectrum disorder may have challenges understanding tone of voice or facial expression in social situations. Speech-language impairments. Those who are nonverbal may demonstrate the following: lack of an effective way to communicate may lead to the need for the use of alternative argumentative communication, such as sign language, pictures, or a voice output device. Those who are verbal may demonstrate the following: grammatical structure which may appear immature, that is, telegraphic speech, improper tense or use of pronouns, or grammatical structure which may appear pedantic, for example, monologue, advanced vocabulary in an area of interest. Restricted repetitive and stereotype patterns of behavior, interests, and activities. Excessive adherences to routines and sameness, such as being distressed by changes in the schedule, insisting on adherence to rules, or having inflexible thinking. Ritualized patterns of behavior, such as repetitive questioning or pacing. Executive function impairments. Individuals with autism spectrum disorder may have difficulty with a wide range of executive functioning tasks, such as sequencing the order in which to dress themselves, tie their shoes, pack for a trip, or complete a homework assignment. Rigid, inflexible thinking is a common characteristic of individuals with autism spectrum disorder, and therefore, individuals may have trouble problem solving or generating more than one solution to a problem. Common learning characteristics. Many individuals with autism spectrum disorder can better process information when presented visually. They may benefit from pictures, modeling the behaviors of others, hands-on activities, and concrete examples. Some individuals with autism spectrum disorder are high achieving in all areas. Some have high word recognition skills but poor comprehension. Others have high calculation skills but poor applied math problem skills, and a proportion are low in all areas. Additional considerations. The use of medication for seizure activity, mental health disorders, behaviors, or other conditions. Eating problems such as pica, overeating, and eating only particular foods. Components of an effective educational program for students with autism spectrum disorder. Direct instruction of skills, instruction in natural settings, and behavior management. Direct instruction of skills. Applied behavior analysis is an effective approach to understanding and changing behavior and teaching new skills. Applied behavior analysis methods based on scientific principles of learning and behavior to build useful connections and to reduce difficult ones. The ultimate outcome of using applied behavior analysis methods is to be able to use the learned skills and behaviors and convert it to other settings and situations. Instruction in natural settings. Educators of students with autism spectrum disorder are constantly encouraging the use of behavioral psychology in natural settings and in natural interactions. That is, the type of settings and interactions that children without disabilities enjoy. Instructional use of the natural interactions by which children normally learn language and other social skills is necessary in the teaching and learning process. Behavior management. Managing difficult behaviors of students with autism spectrum disorder requires a cooperative team problem-solving process that includes parents and others who interact with the student. It is vital that the team consider the student's behavior across various situations and how to manage behaviors that arise in a different environment and conditions during the day. It is also important to create stability across the cooperative team in regard to both expectations and planned responses. Parenting a child on the autism spectrum. These are some pointers. Focus on the positive. Stay consistent and on schedule. Put play on the schedule. Give it time. Take your child along for everyday activities. Get support. Look into respite care. And this is talking about seeking the assistance of someone else to help you. Take care of yourself. This is the end of my presentation. Thank you so much for watching. Remember to click like and subscribe to my YouTube channel. Until next time, take care. Bye.